Thanks for joining me today. I have the privilege of having with me Rob Jensen, who is the president and CEO of AAMI, one of our most famous associations. Rob, how are you today?
I'm great. Thanks for asking, Phil.
Thank you for joining me. You know, canceling the AAMI meeting was probably a very tough decision, and I imagine everyone would agree that it was the right decision. What factors went into making that decision, may I ask?
Sure. We had insurance for a pandemic event, which is relatively unusual because that's usually excluded from event insurance policies. But we had taken that exclusion out, and therefore we're eligible. But the insurance company required that we notify them essentially as soon as we began thinking about whether or not it was going to be a commercially viable event. So we notified them and said we may or may not cancel, and we held for another 4 weeks after that. But as we approached the time where our vendors were going to need to ship to New Orleans, and New Orleans center was still being used for a hospital, essentially at the direction of the mayor, that's when we made the decision. And yes, it was actually fairly gut-wrenching. It's the first time in our history that we've ever had to cancel that event. It's also one where we recognize a lot of our awardees on an annual basis, and we also have a set of board meetings, annual board meetings, that goes along with that in our full annual meeting. So it was a fairly difficult decision, but most people, the vast majority of people, after we did so, said, yeah, that was the right call. And so now we're trying to help folks out and recovering a bit from that in terms of the kind of the feelings that go along with not being able to hold, your sort of annual meeting.
Yeah, I, for one, was very disappointed that I understood why it had to happen, but I was disappointed because it's a fun meeting and it's a very lively group and everyone has a great time. So I was disappointed. I wonder, how is the coronavirus impacting training programs, and how are you addressing that?
Well, that's a great question, Phil. We are now doing all of our training virtually. There is no face-to-face training that we've done since this whole virus event has sort of splashed across the nation. Immediately we found that folks responded to our virtual training, and we are now rapidly moving all the training that we do over to a virtual environment to allow them to take advantage of the same training that they would have and the quality training that they would have at AAMI as a group, doing that whole thing online. The acceptance has been far better than I ever anticipated. And in fact, after a couple of missed beats at the very beginning, when there was a lot of chaos, most of the normal folks that we would see, industry, some of the hospitals, some of the independent service organizations, have come full bore to the virtual training and actually exceeded our expectations. So it's so far so good, and we think that will help us create a future where we provide more options to our stakeholders, whether it's virtual for training or virtual for seeing some of the exchange tracks, if you will. So we're really working to expand our opportunity space to more adequately fulfill the needs of our customers as they're changing.
Okay. Another thing that occurred to me is that HTMs are really critical in dealing with fighting the pandemic. Do you believe that they face any unique challenges as compared to other hospital employees?
Well, there was one challenge that we became aware of early on, and that was that there were some areas where HTMs were being challenged about whether they were essential or not. So we brought that question in-house and crafted a letter in coordination with several of the government agencies that are involved in what kind of language was appropriate to be used. And we crafted a letter that's now available on our website for anyone that needs it that's serving in an HTM capacity to show that they are in fact an essential employee. I think as far as, I think challenges are like they always were. There's some challenges with getting access to the right manuals, and that's maybe parts. We've certainly seen the supply chain clogged up in various spots, but I think there's an opportunity here with what we're seeing in terms of 3D printing. Some of the organizations have turned to 3D printing to solve some of the localized problems with regard to some of the supply chain issues. And we're taking a look right now at whether or not that's a role that may be able to be taken on effectively by the HTM shops as clinical engineers and HTMs on levels that may be a step down from a clinical engineer per se, but they could help hospitals with those kinds of needs at low volume 3D printing production.
I see. Is AAMI offering any special guidelines or advice to HTMs and to help them stay healthy?
I think our Vice President of HTM, Danielle McGarry, has done a great job coordinating through all the local, state, and regional HTM groups to help them understand. I think it's less about us providing any special guidance than helping them understand the guidance that's already out there from the CDC and making sure it gets down to their particular level. You know, there's many of them that work differing shifts. Certainly the news is not consistent in terms of sometimes putting out what needs to be done. So we've really tried to reinforce and provide access to what the guidance is from the CDC and the clinical areas. We did stand up a special access to our website that's COVID-19 specific. It provides free standards and several other details of where people can go to get specific types of assets. It answers some questions that FDA asked us to put up, so to kind of begin to capture some of the call volume and answer those questions online, so it was smoother and that people were getting consistent answers. So while we haven't specifically gone to HTMs with anything different than the government has done, our intent really is to reinforce the specifics that the CDC has been publishing.
Okay, well, you know, AAMI is a great organization. As I say, I'm looking forward to next year's meeting and our symposium that we hold. And Rob, I want to thank you for spending time with us.